Namaste, everybody. Welcome. Good evening to those of you joining us live, and greetings to all of you watching this replay. I'm Love Coach Scott Katamas, and welcome to Saturday Night Alive for the Global Peace Tribe. And this, of course, is our early show, which is one of my favorite parts of every Saturday night because we've been preparing all week, getting the show ready. We get to start with you, our friends, our kind of closest friends and fans. So most of you know the drill by now. Let us know your name and where you're from. And how wonderful, as always, to see John from Norfolk, Janet from Spanish Fort, Alabama. You two are always right there towards the beginning. Also want to welcome Pauline from Michigan, Eleanor from Vancouver. I really appreciate our kind of loyal friends, fans that are always there. It's almost, to be honest, it always makes me feel kind of like, oh, okay, our friends are here. We're going to have a really lovely show today. And it's going to be a little bit unique in some ways. We've invited some of our absolute favorite regulars, magician Sean Jay, musicians Cornflower, Kristen Hoffman, wonderful dancer Casey Chai. But we also are inviting some new friends as presenters. We are going to have a wonderful video of Deepak Chopra. But we've got Dr. Kristen, my good friend James Schmachtenberger, Troy Stallman, who also doubles at night as Kristen's beloved. And we're going to really be learning some very valuable information about how we can best have the best possible radiant health, really, including some things that have blown me away as I've been working with today's presenters. And learning all about brain function. I'm getting older, I'm 65. I want to have great brain function. And I'm really learning a lot from both James and especially Dr. Heather Sandiston. So with no further ado, I'm hoping that they're going to turn on their cameras so I can bring them on and have them join us. I'll start by bringing on James. This is James Schmachtenberger. And James is a long-term friend of mine, and he is also the CEO of the Neurohacker Collective, which is providing the absolute up-to-the-minute information about brain chemistry, body chemistry. He's got a remarkable group of doctors and scientists that he works with. I've known James personally for many, many years. And so I've been using his products, which we'll talk about a little bit later. And James, I'd love to have you introduce Dr. Heather.
Oh, that sounds great.
Yeah.
So
since you've known her longer, so I'll let you do the honors.
Yeah. No, first, thanks for having me on. Scott and I've been friends for probably a good 10 years now, but first time to be on the show. Delighted to intro Heather. Heather has been a friend and colleague for several years now. I don't actually remember exactly how many, but I guess a few things to note about Heather is she has dove into areas of study around medicine that very few doctors ever have, particularly being able to dive into the complexity of certain kinds of disorders that most doctors tend to shy away from because the success rate around addressing them is low, but that's because of not having the right model of science. And Heather spent now several years deeply studying for the ability to work with very complex disorders, particularly cognitive. Her specialty is largely around addressing dementia and Alzheimer's, though all kinds of complex disorders. But yeah, phenomenal naturopath, phenomenal person, great friend, and so delighted to get to introduce you and get to listen to your presentation tonight.
James, thank you so much for that kind introduction. And it's an absolute privilege to be here. It's been a privilege to work with you and everyone at Neurohacker. And I'm excited to share what we've learned.
Dr. Heather, tell us a little bit about what kind of brought you into this. We really want to hear a little bit about your history and how you got involved in this incredibly important work.
Sure. So I started seeing cognitive decline patients with Alzheimer's After learning from Dr. Dale Bredesen, who I know was a recent guest on your show, he had presented at a conference about his protocol to reverse dementia. And I was intrigued, but a little skeptical, right? We're told over and over and over that there's nothing you can do for dementia. And so when he presented a model of medicine that was similar to my own, where it was complex enough to appreciate a complex system like the human body, and met the degree of severity for dementia, right? We want to take a comprehensive approach. We want to be looking at everything that influences brain health at a cellular level. So this meant toxins and hormones and nutrients and exercise and sleep and a lot of things that I'll get into further this evening. So when I heard Dr. Bredesen's approach, it made sense. There was some common sense to it, although unfortunately not common practice. And I got back into my clinic and there were patients showing up. I was now on the list of people who had been trained by Dr. Bredesen. So enthusiastic patients showed up. And sure enough, my first patient, Linda, who arrived with her husband, and unfortunately she could really only speak with yes or no one-word answers. I would ask her a question and you could see the wheels in her head spinning, trying to understand what the question was and then trying to find the words to respond. And yet by the time she responded, she had forgotten what the question was. Her handwriting was affected, and you could tell that her relationship with her husband had been severely affected. Well, this husband and wife, they took the protocol and they ran with it. They came back just 6 weeks later and her MOCA score, so we could measure her cognitive improvement. She was speaking in full sentences. And believe it or not, she was bickering with her husband about something that had happened the night before. And I thought, if this was possible for Linda, could you imagine how many people were suffering unnecessarily with this disease? And it was essentially criminal at this point to tell people there was nothing you could do for dementia. There was lots that we could do for dementia. And if some people could get started earlier, if the narrative could change, if people could know that when you start noticing cognitive decline, when you have those senior moments, or you misplace your keys more often, or you can't remember those words you used to, that is the moment to look for help. That is when we have the most confidence that we can reverse things.
You know, I'm going to kind of be vulnerable here for a moment. I'm beginning to I'm 65, and it's so interesting. I can remember, like when I'm working with my clients, I remember details about their lives and sessions that they don't remember sometimes, but I'm having trouble remembering people's names sometimes. That's like everything else, my memory is great, but all of a sudden it's like, what's the name of that actor? What's the name of that guest? And, you know, I'm having that challenge. So I've started using the Qualia Mind. And tell me a little bit about what can we do? Because listen, I don't want to have dementia. I'm getting that very first early warning signal. My issue with remembering names started maybe about a year and a half ago. So tell us a little bit more about what we can do.
Yeah, this can be a really frightening, scary experience for people because, again, we're told there's nothing you can do. You may have had a loved one or someone you knew who you've seen go down the path of dementia. And it's just absolutely horrible. I mean, it's just horrific. And so what I encourage everyone to do is, you know, like you have done, start with Qualia. Qualia is a phenomenal product. I'm actually doing a clinical trial in my office right now. And one of the foundational things we're doing for everyone, in every participant in the trial, is starting them on Qualia. Qualia Mind has nootropics, lots of vitamins, nutrients that are necessary for brain function. And so if we're missing any of those, that can be absolutely foundational. The other thing we do, if a patient like you were to show up in my office, which I would highly encourage you to work with someone, is we systematically go through all of the things that can affect brain function that we know of right now. So there's a lot we don't know. There's a lot that we're still learning. This research is new, and unfortunately, part of the reason is because the internal review boards, or the bodies that govern and watch out for participants in studies and human clinical trials, they say yes or no to research trials. And of course, they want to be protecting vulnerable patients, a vulnerable population like those with dementia. However, what they've done is they also have prevented us from doing research until very recently that takes into account multifactorial, things that have not just one answer. There's not one molecule or one drug that can change this picture, the symptom picture. We really need to consider lots of different things. And so that's exactly what we do. When someone like you comes into my office, I do a happy dance because it's early. And so I have a lot more confidence. Now, we have seen patients like Linda where there's severe cognitive decline. She had a MoCA. A MoCA is the Montreal Cognitive Assessment. It's a 30-point scale, and normal if you're don't have a graduate degree is over 26. If somebody has a law degree or a medical degree, any sort of graduate degree, you really want a 30 every single time, and it's probably not going to pick up cognitive decline for you. For everyone else, then 26 is usually okay. But now she had a 2 the first time we saw her. The second time we saw Linda, she had a 7. So she had really improved pretty dramatically and much more than we expected. But this doesn't happen every time. And our research is really dedicated to figuring out who can this work for and who maybe shouldn't spend the time, the effort, the money changing their diet, getting on all the supplements, getting on the hormones, doing all of it takes work, it takes effort. And so we want to be able to honestly say to people, this is who it works for and this is who it doesn't. What we know right now is for someone like you, it works. We have high confidence that someone who's in the earlier stages, we can get turnaround. And so the way we do that is systematically, we do the lab. So I'm a data person, I'm a researcher, and I like getting the numbers. So I want to know the levels of toxins that might be affecting your brain. We know that mercury and lead are neurotoxins. We know that mold toxins are harmful to your brain. We know that chemicals like glyphosate, parabens, phthalates, PCBs, petrochemicals, these can all have an impact on your immune function, which can then have an impact on your brain, can also directly be neurotoxic. So we want to know about toxins. We want to know about structure. Is your neck lined up right so that blood flow can not only get into your brain, but get out of your brain? At night when you sleep, do you snore? Is your airway affected so that maybe you're not getting enough oxygen to your brain at night when your body does so much detox work, so much processing? So we want to know about structural issues, not only at a macro level, the way maybe a chiropractor or orthopedist might think about it, but also at a genetic level. Do you have a genetic predisposition like an ApoE or an APP, the amyloid precursor protein? There are a few things we can look at there that tell us if your risk is the same as maybe your spouse or your neighbor, or if it's a little bit higher and you need to maybe make a little bit more effort a little sooner. So toxins, nutrients are another really big piece. Are you getting all of those building blocks like the things in Qualia so that you have enough of the neurotransmitters that allow you to make those memories, that keep your mood stable? We know that stress is can directly affect and directly impact how well we think. This is why torture is such a horrible idea. Is nobody can remember what happened when they're under a lot of stress, right? This is stage fright. It's very hard to remember when we're under high amounts of stress. So addressing stress. So toxins, nutrients, structure, stress, and infections. We know right now that the Lyme spirochete, Borrelia burgdorferi, the P. gingivalis, which is a bacteria that can affect the mouth, and then also the herpes simplex viruses. Those directly impact inflammation in the brain, and it should be treated pretty aggressively if you're starting to have cognitive symptoms, or in the event that someone has identified some genetic predisposition. So that is how we would start. And taking care of foundational things like sleep, diet, exercise. A ketogenic diet is something everyone who is concerned about their brain should try at some point. Now, it's not the right diet for everyone. So you want to work with a coach or a nutritionist or a doctor to make sure that it's the right diet for you. Follow labs, especially cholesterol levels and cardiovascular risk markers. But it's a great thing to try for anyone who hasn't, because sometimes it's just that easy, particularly, Scott, for someone like you in their 60s, 50s, 60s, the side effects are better blood sugar regulation, better mood, and weight loss. So most people don't mind those. So it's worth a shot.
Beautiful. I'm going to go to a couple of you. You have two websites, and I just want to give everybody all the opportunity to find out more and to learn more from you. So this first one is solcere.com, SOLCERE.com. And I see that on this, you've got a lot of things that you provide people, blogs and information. Is there any place you want to direct people to? Certainly these blogs look really important, where people can go in and learn more about advanced nutrient therapy and peptides and intravenous therapy. So thank you so much. And I see that there's a lot of articles and also a lot of podcasts that you've done. All the collective
podcasts we've done with Neurohacker.
Right. So actually, that's a good opportunity for me to bring James back on. So I'm bringing James back onto the screen. But is there anything else you want to just share with us about this website first?
No, if anyone is interested in working with a doctor around this topic, we have a handful of doctors here at Solstercom who are trained by Dr. Bredesen, who are doing this protocol here in the office every day. And it's so satisfying. It's such a privilege to be working with people and watching them. It's sort of like seeing a flower bloom, to see some of our older patients with more advanced disease just kind of reawakening, coming back into the world.
And I'm scanning through, we're taking a look at all the different doctors that you work with. Now, does this need to be in person, or do you do Zoom referrals or Zoom meetings with people? Zoom consultations?
So all of our doctors are licensed in California, in the state of California. So if anyone is in California, anywhere in California, we would love to see them and help. If they are outside of California, we would love to see them and help and have them come in person just to establish care. And after that, we can do follow-up by Zoom.
Okay, great. And then for people that are taking care of loved ones that are more advanced, then tell us a little bit about this part of your world. It's called the Marama Experience.com. Tell us a little bit about that.
Yeah, so after seeing Linda and patients like Linda, where their cognitive decline was reversing miraculously, but with some hard work, I started to develop a reputation around seeing people with dementia. And so I was getting questions from people asking, where can I send my loved one? I really want them to be able to benefit from this protocol. However, I've got my kids and I'm working full time and I just don't have the capacity to cook keto for my mom and get her engaged in exercise and do all of these things all day. It's a lot of work. So I looked around wondering where I could trust to send people who I cared about. And I found that there really was no place, there was no immersive experience in Dr. Bredesen's protocol. So of course I thought, how hard could it be? And created one. So Marama is in Vista in Southern California, here in San Diego County. And I spend quite a bit of time there and have created the protocol so that every day the residents who are there, they wake up and their entire day is built around getting their cognitive function back. So they are engaged in brain training activities. We have a gym on site where they can ride a bike and do contrast oxygen therapy. We've got red lights, we've got biomats. We've got two greenhouses on the property, so they get involved in gardening. And then they have the social engagement of each other. It's so neat to watch them encourage each other, celebrate each other's successes. Our staff is trained to expect reversal, right? Many times when people move into a home, a residential care facility or nursing home, we expect them to go downhill because unfortunately, what society has told us is okay is to feed people cake and cookies and cereal for breakfast, a sandwich for lunch, and pasta for dinner with cake and cookies afterwards. And that is the worst diet for the brain. They also are, essentially parked in front of TVs. They stay in wheelchairs or in bed. And movement is one of the worst. Not getting enough movement is one of the worst things we can do for our brains. So we expect steep decline when someone moves into a nursing home. At Marama, we expect the opposite. We expect their fall risk to go down, their blood sugar to stabilize, their hypertension to be reduced, and many of them get off medications, and their moods improve, and they get back that cognitive capacity most of the time. We're still figuring out who it works best for, and I can't promise results, but certainly we expect them.
I love that. I just love the vision and everything you're describing, and it's true. When I was young, I worked in a nursing home. My mother and I both worked in a nursing home, and I saw exactly that. It was just like basically people came there to die and to just decline, and everything that took place promoted the decline. So it's beautiful what you've created, getting people up and moving, and most of all, the vision that you expect people to get better. That consciousness, it really touches me because of my experience working in a nursing home. That's such a totally different consciousness. I mean, the consciousness where I was way back as a boy working there was, well, there are, just see them through until the end, right? So that's beautiful. All right, I'm going to bring James on one more time. There he is. James, I want to go back a step because she talked about nootropics. Some of us might know about nootropics, but many of us don't. So tell us a little bit about what nootropics are, why they're so important, and then your work with nootropics.
Yeah, absolutely. So the word nootropic essentially means any ingredient or molecule that will benefit some part of brain function without causing harm. So it's actually a pretty broad term and pretty broad category. Oftentimes when people reference the word, they will be talking about sort of particular classes of chemicals that tend to be in the more experimental realm. But what it actually references is just the ability to improve cognitive function without harm. And that part without harm is really key, right? Because there are absolutely things that you can do to improve cognitive function in the short term that will cause long-term damage. Right? A lot of times people will take various kinds of stimulants, caffeine obviously being the most common, but at this point, people utilizing things like Adderall and modafinil is very, very regular. And though those will cause enhancements in certain types of brain function in the short term, they tend to cause fairly significant issues over duration. And so the whole world of nootropics is really the study of how do we, what ingredients can we use, what things can we do to be able to improve all the different types of brain function in sustainable ways. And that's been, at the basis of a lot of the work that we've done at Neurohacker. As years have gone on, we've moved into multiple areas of health, but we started specifically in cognitive function and spent actually about the first almost 5 years of the company really dedicated just to cognitive function, using all kinds of different nootropics. And that means, various kinds of botanical ingredients, different minerals, different vitamins, amino acids. It goes quite broadly. For us, the focus in utilizing nootropics has really been to take, as sort of Heather referenced, a complex systems orientation. Right? Most of medicine in general, and this is very much true in the world of cognitive function, follows a really reductionist approach. And people will say, hey, there's something not working, I want it to be better. And we'll look at the sort of most narrow understanding of what causes that challenge, and then what is like a single thing that we can do to be able to improve it. But that's not actually the way that human physiology works. There are times where there's a single cause for whatever you're experiencing, like you get into a car accident, you break your arm. That's fairly straightforward, and traditional medicine is very good at being able to deal with that. But when you start to get into more complex arenas like neurodegeneration, like autoimmune disorders, then it requires a much more complex approach where you're taking into account many, many different variables that are going to affect. And so what we've done at Neurohacker is spent the time to, essentially apply complex system science to the study of human physiology. And what that really looks like is we map out an entire system. How does the entire system work in its optimal fashion? And rather than trying to improve one or two particular areas, we work on creating formulas that will provide the base nutrients for the entire system to work better. So a huge part of what we're actually looking to do is to bring systems into homeostasis, and then what we refer to as increasing homeostatic capacity. So you can be in homeostasis, but still be relatively vulnerable. right? A particular stressor will knock you out and it's hard to get back into equilibrium, or you'll get exposed to a toxin and your body's not capable of getting back into it. So it's important to get into homeostasis, but then to actually increase the body's resilience or ability to get back whenever things throw it off, because inevitably that's going to happen. And if you can do that, then the body has the ability to adapt to all kinds of things and to be able to produce more and less of the various neurotransmitters that are needed in real time based on whatever it is that is occurring. So.
And tell us a little bit about Qualia. And again, Qualia is something that I use all of Neurohacker's products now, but, and this is the first time this is our 82nd show. And it's the first time that I've ever promoted a product that I use. So this is unique. And I want you to know this is because I believe in it. I remember my own name again. No, seriously, it's wonderful. So explain to us a little bit about Qualia. What is it in Qualia that really makes such a significant difference, James?
Yeah. So Qualia Mind, which is the product you're holding, is our flagship product. It's the most popular one that we carry. And what it's designed to do is to be able to increase functionality in all the different types of brain function. So most of the time when people start to look at cognitive function, they take a fairly narrow approach. They're looking at focus and attention, right? Those are the main things that people care about. And though those are important, it's only a small subset of what the brain actually does. And if you just increase focus and attention without being able to improve all the other types of cognitive function, it tends to create a series of imbalances. So what we've done here is we've created a formula of 28 different ingredients, where each ingredient has been heavily studied individually for their impact on different types of brain function. And then we've taken that further and studied the synergies around how those ingredients interact, and specifically how they interact in human physiology, and then adapt the formula to be able to make sure to maximize those synergies. And the goal there is to be able to have meaningful increases in all the different types of brain function. So we are working on increasing focus and attention span, but we're also working on improving things like discernment and critical thinking, right? Making it easier to be able to understand and make sense of the world that you're in, being able to support improvements in recall. And and there's actually several different kinds of recall. There's, depending on what model you're looking at, there's about 26 different kinds of cognitive function that have been defined. And our aim with this product is to be able to provide meaningful improvements in all of those. And then one of the things that we do fairly uniquely, and part of the kind of mission and reason why I started the company, was in addition to increasing cognitive function, we looked at the parts of the brain and nervous system responsible for things like empathy and compassion, and then provided nutrients to be able to support that, so that what ends up occurring is you've got people who become meaningfully more intelligent, but also become more empathetic, more present, more compassionate. And ultimately, that was actually the driver in building Neurohacker, was the idea that if we could have millions of people who were meaningfully more intelligent, who could make better sense of the world, who were very capable, who could do powerful things, and we could cause them to be more empathetic, more compassionate, then there would be an intrinsic driver to use that increased intelligence and that increased capacity, not only for personal gain, but also to benefit their families, their communities, and ultimately the world at large.
Beautiful. And again, I've had the advantage of knowing James and his brother, who started this company, and watching how it's grown and all that they're doing. James, we've only got like a minute and a half left. So I just want to remind people of a couple of things. I want to go over your products briefly. But James, to be really transparent, has given both Saturday Night Live, he's giving us, to be really honest, a lovely commission for the people that buy through us. And it's a lifetime commission. So for anybody who tries Qualia, likes it, continues to use it, we're going to get a nice commission, which will help us to continue this show. So I want to thank you for that, James. And it's very, very generous. It's above and beyond what they normally do. And they're also offering an additional 15% off code. In addition to, on your first buy, you're going to get 50% off. So 50% off, and then another 15% off to get started. Obviously, Qualia Mind is the product that is kind of, as you said, the flagship. If you're to start with one, start with this. But there are other products as well. And again, you may want to get started. Is there any particular package? If somebody wants to start with a package, what would you suggest, James?
Yeah, I mean, the most common sort of package that people do is the combination of Qualia Mind, Qualia Life, which is our anti-aging longevity formula, and then Qualia Night, which is designed to support improvements in sleep. And then, I mean, those three together are a pretty powerful life upgrade.
Right. Yeah, so if people take the code, the link that Deborah is putting in the chat box, if you take that and you go, it'll take you to this page. That's where you're going to put in your code to save more. And there's the bundle that you're suggesting: Qualia Life, Qualia Mind, and Qualia Night. Yeah.
Yep.
James, thank you. Heather, I hope you saw in the chat box, people are really appreciating you. And again, you work with Dr. Bredesen. We really enjoyed having him on the show before. And I'm already thinking ahead that I'd love to do a show in a couple months because we repeat certain themes. Let's do a show with you and Dr. Bredesen together. That would be really fun. So, well, I want to thank both of you. And I'm now going to get us ready to go live on Facebook, which always takes me a minute. So, and again, welcome everybody. If you haven't given us your name and location, please do so. We see a lot of our friends. We've got over 100 of our friends already in the Zoom room, and we're getting ready now to go live on Facebook.